Welcome back, medical enthusiasts. Today, we dive into the world of bronchiectasis, a lesser-known respiratory condition that deserves our attention. Join us as we explore the causes, symptoms, and treatments of this intriguing lung disorder. Bronchiectasis is a chronic condition that affects the airways in our lungs. In this disorder, the bronchial tubes become permanently damaged and widened, leading to the accumulation of mucus and bacteria. As a result, breathing becomes more challenging, and recurrent infections may occur. Before we continue, make sure to hit that subscribe button and ring the notification bell, so you never miss any of our fascinating medical content. Your support helps us keep creating valuable videos like this one. So, click now and stay updated with the latest medical insights. Now, let's travel back in time to the ancient medical world. Did you know that bronchiectasis's earliest description can be traced back to the ancient Greek physician, Hippocrates? Yes, that's right. Hippocrates referred to this condition as staphyloma, and he noticed its connection to chronic cough and sputum production. The knowledge of bronchiectasis has indeed traveled a long and fascinating path. Hippocrates' observations. As mentioned in the previous text, the ancient Greek physician Hippocrates is credited with one of the earliest descriptions of bronchiectasis. He used the term staphyloma to describe the dilation of the bronchi and noted its association with chronic cough and sputum production. Old names, new meanings. In the 19th century, bronchiectasis was known as fetidus because of the foul-smelling breath associated with the condition. This unpleasant symptom resulted from the accumulation of infected mucus in the dilated bronchi. Misdiagnosis as tuberculosis. Before the advent of modern diagnostic tools, bronchiectasis was often misdiagnosed as tuberculosis due to some overlapping symptoms, such as chronic cough, hemoptysis, coughing up blood, and weight loss. It was only later that the two conditions were distinguished from each other. Hemorrhagic bronchiectasis. In the past, bronchiectasis was sometimes referred to as hemorrhagic bronchiectasis, because severe cases could lead to recurrent episodes of bleeding from the bronchial tubes. This symptom was not only alarming but also challenging to manage effectively. Laennec stethoscope and bronchiectasis. René Laennec, the French physician who invented the stethoscope in 1816, made significant contributions to the understanding of various lung disorders, including bronchiectasis. His invention enabled better auscultation of the lungs and helped physicians detect abnormal respiratory sounds associated with the condition. Tuberculosis and bronchiectasis contrasts. Despite their similarities in some symptoms, bronchiectasis and tuberculosis have distinct clinical courses. While tuberculosis can often be effectively treated and cured with antibiotics, bronchiectasis is a chronic condition, and the underlying damage to the airways is irreversible. The forgotten disease. Historically, bronchiectasis was overshadowed by other respiratory conditions, such as tuberculosis and pneumonia. Due to the lack of effective treatments in the past, many cases of bronchiectasis were left untreated, leading to significant suffering for patients. Although rare, bronchiectasis can be caused by various factors, such as lung infections, genetic disorders like cystic fibrosis, autoimmune diseases, and even inhaling harmful substances. Understanding the underlying cause is crucial for effective treatment. It can lead to a range of medical problems and complications, including chronic cough. Persistent coughing is one of the hallmark symptoms of bronchiectasis. The constant irritation and inflammation of the bronchial tubes can trigger a chronic and sometimes productive cough. Sputum production. Bronchiectasis often leads to excessive mucus production in the airways. The accumulated mucus can become infected, resulting in recurrent respiratory infections. Recurrent respiratory infections. Due to impaired airway clearance and the presence of infected mucus, individuals with bronchiectasis are more susceptible to recurrent respiratory infections, such as bronchitis and pneumonia. Shortness of breath. As the condition progresses and the airways become further obstructed, individuals with bronchiectasis may experience shortness of breath, especially during physical activities. Hemoptysis. Bronchiectasis can cause bleeding from the bronchial tubes, leading to the presence of blood in sputum, hemoptysis. Severe cases of bronchiectasis may result in recurrent episodes of hemoptysis. Fatigue. The chronic nature of bronchiectasis, along with frequent respiratory infections, can lead to fatigue and reduced energy levels. Respiratory failure. In advanced stages or cases where bronchiectasis remains untreated, respiratory failure may occur. This is characterized by the inability of the lungs to provide adequate oxygen to the body, leading to severe breathing difficulties. Lung abscess. In some cases, the persistent infection and accumulation of pus within the bronchiectatic airways can lead to the formation of a lung abscess. Atelectasis. Bronchiectasis can cause the collapse of small areas of the lung, atelectasis, due to airway obstruction and reduced lung function. Cor pulmonale. This is a condition where chronic lung disease, such as bronchiectasis, can lead to right-sided heart failure. The increased resistance in the lungs puts a strain on the right side of the heart, eventually leading to heart failure. Chronic respiratory insufficiency. Over time, bronchiectasis can result in chronic respiratory insufficiency, where the lungs are unable to perform their vital gas exchange function effectively. Recognizing the signs of bronchiectasis is vital for early diagnosis. Keep an eye out for persistent cough, excessive mucus production, shortness of breath, recurrent respiratory infections, and chest pain. If you or a loved one experience these symptoms, seek medical attention promptly. While bronchiectasis cannot be entirely cured, there are various treatment options available to manage the condition and improve the patient's quality of life. Treatments may include airway clearance techniques, antibiotics, bronchodilators, and in some cases, surgery. Before we conclude, we want to emphasize that the content provided in this video is for informational purposes only and should not be considered medical advice. If you suspect you have bronchiectasis or any other medical condition, please consult a qualified healthcare professional for proper evaluation and personalized treatment. Thank you for joining us on this journey to uncover the mysteries of bronchiectasis. As always, awareness and education are essential in understanding rare medical conditions and supporting those affected by them. Don't forget to like this video and share it with your friends to spread awareness about bronchiectasis. Remember, the pursuit of knowledge never ends. Stay curious and stay informed about all things medical. If you have any suggestions for future videos or questions you'd like us to answer, drop them in the comments section below. Until next time, take care, and keep learning.